Piers Morgan and Susanna Reid were joined by Professor Shafi Ahmed, Dr. Asher Salmon from the Israel Health Ministry, and Professor Devi Sridhar on Good Morning Britain to talk about the UK's latest steps to stop the spread of coronavirus. Morgan was quick to reveal what steps he thinks runners should take to help those out and about feel safer. "I'd like people to stop running on busy streets and breathing heavily," Morgan remarked. Reid added, "and spitting." To which Morgan continued, "all over everyone they run past. I just think it's unbelievably selfish. It's like, go and run in a park, they're all open." Reid chipped in to note, "Parks are very busy though," but Morgan carried on, "Just stop running down the high street blustering over people. I just think it's ridiculous." It wasn't the only complaint Morgan had on their show, as he also hit out at Professor Chris Whitty for giving an exclusive interview to the BBC. The chief medical officer was expected to answer questions about the pandemic on BBC Breakfast on Monday morning, which left Morgan infuriated. He posted on Twitter, "The chief medical officer should not be giving exclusive media interviews during a pandemic. You have a duty to speak to our viewers too." Professor Whitty at CMO, England, "Their lives are as important as those of BBC viewers. Please reconsider this decision." However, Morgan did speak to Vaccine Minister Nadhim Zahawi, who explained care homes are the #1 priority to receive the vaccine. "Last week, on the 4th of January, we got the Oxford/AstraZeneca vaccine. The first 2 days the chief medical officer wanted it to be only in hospitals, then we rolled it out into the primary care networks," Zahawi explained. "Now we got 300 roving teams that go into care homes, doubling up to 600. Some areas have done all their care homes already, others are beginning, or starting now. There is variation and I'm not going to shirk that, but that will change tomorrow and the day after and the day after. They are absolutely priority, the #1 category on the list of 9 most vulnerable that the Joint Committee have given us to vaccinate. The Oxford/AstraZeneca vaccine makes it much easier to get into care homes for those primary caregivers." He continued, "For every 20 residents of care homes we vaccinate, we save 1 life. That is the highest return on the vaccination program we could ever achieve. For every 250 people of the top categories or cohorts, we save 1 life, but for every 20 we save a life, which is why it's a priority, and you will see that very much now we've got Oxford/AstraZeneca vaccine in care homes."